Good morning and good afternoon. Thank you for your invitation to the 7th Nikkei Financial Times Conference on Communicable Disease. My name is Dr. Thakker. I'm the Chairman of Africa Health Business and the President of Africa Health Federation. Let me start by thanking Sysmex, the Nikkei team, and all the organizers on putting this conference together. I want to begin by talking about the situation of COVID-19 pandemic in Africa and how it has affected the entire treatment and management of malaria on our continent. As you all know, it was in the month of February that we found our first case of COVID-19 on the continent in Egypt. Since then, we've seen the cases rising rapidly across all the nations, and it's at this point we are hoping that to see the curve drop down and have fewer cases. Africa was the last continent to be hit with this pandemic, and we had an advantage because we saw the impact, we saw how the other countries were dealing with the condition, so we were ahead in that matter, but we also came together very rapidly as countries to control the spread of the pandemic. We had to take tough measures like lockdowns, curfews, cessation of movement, closing up borders, and in addition, we had to ramp up our testing services. When the COVID-19 pandemic broke into Africa, only 2 countries were able to carry out an effective test for COVID-19. Today, all 54 countries are able to test for the virus. We needed to find tracking mechanisms, and we had to look and equip the hospitals and build up infrastructure to treat the patients who will require care. All this cost a huge amount of funds to the Ministry of Health and to the private sector. This sudden surge of COVID-19 took a lot of attention and focus away from the essential health services that were being provided for by national governments and state governments and county governments. This means that many of the communicable diseases, including malaria, were neglected. The reason was the model of making sure that everyone gets tested, traced, and treated on COVID-19 did really affect the entire flow of supply chain. The neglect of malaria was mainly occasioned by the interruption in global supply chain. As you know, prevention is better than cure, and for malaria, bed nets will remain an important way to prevent transmission of malaria across communities. The interruption of bed nets, the interruption of effective medical supplies and medicines, reduced raw materials to the factories that produce antimalarials, and funding for those who require treatment for malaria were all reasons why the neglect took place. In addition to the supply side, there's also been a neglect from the demand side. Patients in the month of March, April, May kept away from hospitals. They did not visit the hospitals with the fear of contracting the COVID-19 virus. And this meant that only when the malaria condition became severe, we saw children and adults and mothers visiting facilities. We are deeply concerned about this and want to reverse the attention so that the essential health services continue to be provided to all everywhere. We think that the mortality cases in Africa is going to be double of what we saw in 2019. We think that over 780,000 deaths might be recorded by the end of December on the continent. We must reverse this trend and start focusing on effective partnerships and effective coordination amongst all the stakeholders. And this is where I'm really delighted that partners like Sysmex are coming forward with diagnostics, and other pharmaceutical industry partners are coming forward with treatment, and the ministries of health are now focusing on ensuring that we give the right treatment at the right time by the right person at the right price. This is what we need to all focus on. If we don't do this, we believe that we will lose about 20 years of progress that we have made in communicable diseases, malaria being one. The Global Fund has announced its commitment to ensure that these services remain uninterrupted. The support to the ministries of health and the countries in Africa will remain strong, and it will be upscaled, and all the health workers involved in this fight to combat malaria will remain united. I look forward to working with partners from Japan, look forward to working with partners from all over the world to ensure we have no loss in the gains that we've made. Thank you very much for listening to me. Arigato gozaimasu.